So good morning, everyone, and welcome to today's installment of the Health Sciences Talk series, where we will delve into a topic of utmost relevance and significance. Our focus today will revolve around the interplay of gender and other vulnerabilities, a participatory action research with informal Syrian CTC providers in Lebanon. Our speakers for the day are Dr. Fuad, Associate Professor of Epidemiology and Population Health at the Faculty of Health Sciences, and Dr. Ruham Yamut, Research Associate in the Epidemiology and Population Health Department at the Faculty of Health Sciences. So the seminar's thematic core lies in the qualitative study conducted by the Rebuild for Resilience Lebanon Team. The research endeavor specifically explores the gendered experiences of the close-to-community providers amid the challenges that are posed by the COVID-19 pandemic. And using a participatory action research approach, the study convened 2 pivotal workshops engaging 8 female CTC providers. And noteworthy is the fact that all the participants are Syrian refugees actively contributing to the healthcare landscape in Lebanon, albeit in unofficial capacities. So here we anticipate a session filled with enlightening perspectives and thoughtful discourse. So as a reminder, the session will take around 45 minutes, leaving around 15 minutes for Q&A. So without further ado, Dr. Fuad and Dr. Yamut, the floor is all yours.
Well, thank you. You hear me? You hear me? Thank you, Salim. And good afternoon. Thank you for coming. And specifically, I would like to thank, our colleagues, and friends, Syrian refugee women that came from Beqa. To be with us and to also to participate in presenting the finding of this result. I will give like a few minutes introduction about the R4R, or Rebuild for Resilience, and then we will have like a very short YouTube video on the R4R. Then Dr. Yamut will present the findings of the study. And then we will have a trailer for a movie that we did. And after that, the Syrian refugee women will present their contribution in this project. So next. So this is us, the group from different countries. So R4R stands for Rebuild for Resilience. It's a sort of consortium to produce good, high quality, actually, multidisciplinary evidence on the health system resilience in what's called now fragile and shock-prone settings, or FAST. So the consortium actually are 4 countries. Sierra Leone, Nepal, Myanmar, and Lebanon. Lebanon is the only academic partner, and the rest actually in Nepal, Myanmar, Sierra Leone are sort of research centers and NGOs. The project is overseen by Liverpool School of Tropical Medicine and Queen Margaret University, with funded from FCDO, and this is a big fund actually for 6 years, started in 2020, and hopefully will end up in almost mid-2026. The team is Ruham, Joanna, Samira, where's Samira, and Yusuf, who's also our coordinator in Beqa. So we'll see now just like a short video on the R4R.
Introducing Rebuild for Resilience. What are fragility and shock? 1.8 billion people live in fragile settings, with that figure expected to rise to 2.2 billion by 2030. Settings are fragile due to diverse stressors and shocks. These include political unrest, conflict and violence, economic or social crises, natural disasters, and climate change. Real-world problems. In fragile and shock-prone settings such as Sierra Leone and Nepal, there are health systems that face severe resource constraints. Events such as earthquakes and epidemics give rise to additional health and support needs. Vital deliveries may not be possible due to travel restrictions, or health workers themselves may be displaced, meaning the delivery of critical services and treatments may be interrupted. How systems respond to shock. When a health system is affected by shock, the response likely falls into one of three categories: collapse, maladaptive or short-term responses, which may cause longer-term problems, or positive or resilient responses. A resilient response, like at this clinic in Myanmar, can encompass absorption, accommodating needs within existing resources, such as working longer hours; adaptation, accommodating needs by changing the way the current system works; and transformation, changing the system permanently in response to the shock, like enabling community health workers to deliver health education sessions in remote areas. What do resilient responses depend on? In Rebuild for Resilience, we think that resilient responses relate to specific dynamics and interactions, such as the link between routine and emergency planning, what resources are available and how resources are used, the dynamics of social networks and how data and information is shared and used for decision-making, and the ability of health systems to learn from previous experiences and remain accountable to their populations. What is Rebuild for Resilience studying? In Rebuild for Resilience, we study how health systems respond to shocks and stressors. We work to identify the strategies and capacities that strengthen a health system, making it more resilient to shocks, and enable the delivery of gender-equitable, high-quality healthcare for all. Find out more about Rebuild for Resilience by visiting rebuildconsortium.com.
Thank you. Next, please.
Introducing Rebuild for Resilience. What are?
So, as you have seen, it's like 4 countries, and each country's setting has their own plan for the Rebuild for Resilience, but also there are many common issues to address too. In Lebanon, actually, we had 2 big ideas, to say on that way, and the one that's about learning site, which is sort of participatory approach research, and the main issue is to strengthen the local communities through improving the healthcare system locally. And we did that in Majd al-Anjar. We still have this project active, and we expanded recently to another municipality, which is Manara. It's not so far from Majd al-Anjar, and we were able to establish what's called now a municipal health committee, which had the role of put the strategic plan for their own community, composed of all population, including refugees, whether Syrians or Palestinians, and actually have their own sort of structure to manage their health needs. This part we will present about the learning site, hopefully in the next seminar, maybe in April. But today we will focus on another initiative that we started 2 years ago on what we call the close to community providers, and we have now the community providers with us here. This is a qualitative research started during the COVID-19 to actually understand, to have the sort of the evidence on the work and life conditions of informal health workers. And it is the same as a sort of participatory approach where we encourage the women CTC to identify the challenge, their own challenge, and how to respond to this challenge, and how they empower themselves, and also to put their own sort of solution and ideas. Now, Dr. Roham will present the findings of this result, and hopefully after that we will have very short trailer, 1 minute, about the video movie on the entire project. I mean, the CTC. We will present that next week. If you have time, please join. And then we will listen to the community providers here about their experience in responding to their health needs. Rohan?
I will take this one. Okay. Hi, hello. I am presenting on behalf of all the team the findings of the studies we did with close to community providers. The first study is about the gendered experience of close to community providers, and it has been done during the COVID-19. The study explored the gendered experience of health workers during the pandemic in Lebanon. It was done through in-depth interview by phone between January and June 2021. The sampling was purposive. We had 12 close to community providers, 8 women and 4 men, and 6 key informants, 3 women and 3 men. We explored the themes of the roles and responsibilities, motivations, preparedness, work conditions, social stigma, mental health, mobility, and diverse themes. We analyze the narratives through thematic analysis. Next, please. What we found that gender played an important role in all the aspects of life of those health workers. In their refugee status life, in their paid activity, and in their social life and interaction with society. Thanks. One of the main findings is that women refugees are much more employable than men refugees in Lebanon, especially health workers. Why? Because community prefer gender separation, and community prefer in general that women take in charge medical care, close medical care, not specialized medical care. They are considered more reliable than their male colleagues by employers, and also because their legal status is much better than the legal status of men, because men do not register as refugees. They do not have residency because they are fleeing the military service back in Syria. Next, please. But women are, although they are more employable, but they are more disadvantaged at the workplace. They have more work. They have more work because first they need they feel the need to prove themselves all the time and to make better impression on their employer. This is why they spend much more energy in working, and they are more solicited by beneficiaries. When a beneficiary enters a center, if there is a woman and a man, the beneficiary will go to the woman firstly, even if the beneficiary is a man. Okay, there is this mentality. People go to women for services more. and they are getting less pay. Why they are getting less pay? Although on the paper, the pay are equal between men and women, but women hold usually lower positions, and they avoid, and over time, and they avoid to take jobs with high responsibilities that require a lot of work and a lot of absence from their home. Women are singled out in challenges for traveling to work. Women are not advised to be alone in taxi because they are afraid of assault. And women who are not accompanied on the streets are not very well seen in the society. So if neighbors see her coming back from work at 7 or 8, it is not good. This is why women avoid to do such things. And a woman alone, if she is hanging around in a very remote place, like for example near an informal settlement, it is not well seen, even by the beneficiaries themselves. And additional features, women talked about double burden on women's lives between the responsibilities at home and the responsibilities at work, and the challenge of fulfilling these responsibilities. The societal perception, a lot of women came from places in Syria where the work of the woman is not well seen. So women like work in secret, and they don't tell that they are working. And also women reported that sometimes husbands like count on the salaries brought by women, and they exempt themselves from any working outside the house, and they take all the decisions on how to spend this money themselves. After we did this, and we disseminated the results of the first study, we called back all the women who were our respondents in the first study to discuss the results and to do the participatory action research. The objective was to identify action to empower health workers to enhance their work and life condition. It was 2 participatory action research workshops of 6 hours each, and 3 reflection meetings that we did after that. Participants, all the women, like I said, who were our respondents, all those women are married, they are all with children, they are all employed informally in informal health sector, and they are all the sole breadwinners of their families. They have all husbands who don't work, and they are all Syrian refugees, of course. In the workshop, in the first workshop, we asked them to list and rate challenges they encounter. In the second workshop, we asked them to prioritize a problem and to analyze it. And we used all the reports and the notes from the meetings and from the workshops. The first finding was that they proposed 50 challenges that we grouped into 17 problem areas. And the first analysis we did, we saw the gender analysis of those problem areas. And we found that 7 of those 17 are problems that are affecting only women. 3 are problem areas, challenges that are affecting both gender, but they affect women more. And 7, those are the challenges that are affecting both genders equally. Next, please. After we ask them to rate those challenges by frequency, severity. Okay, go back. For example, gender-based financial exploitation, the thing that husbands take the money from women. We consider this as something that is affecting only women. Okay. Men are more likely to have higher positions. Men can engage in several shifts. This is also related only to gender. It is a challenge that only women can suffer from. for example. Okay, for example, wages, there are low wages because they are informal workers that are insufficient for their needs. Low wages affect both men and women. Okay, so this is how we classified those problem areas. So after we ask them to rate those problem areas by frequency, severity, and impact, to put a grade from 1 to 5 to each of those 27 problem areas. And this is the rating. And as we can see, if we can see, the pink that is concerning only women, that are challenges that are concerning only women, are not the priority. So we saw that women related problems that are unrelated to gender, they consider them as bigger problems, as priority problems, rather than problems that are related to gender discrimination. In the workshop too, we identified the priority problem area, and they choose to take the priority problem as the double burden of home and work responsibilities. Not because it was the most important and not because it was rated very high, but also because they decided that they will not and they cannot address such problem as low wages, illegal papers, illegal work, illegal residencies, etc. Things that they suffer from in their daily life, but they decided that they cannot address. They decided to take something they can address. And they selected the intervention of establishing a support group that aimed at enhancing their lives and work conditions, not only theirs, but also of all women who are in their situation. The support group aimed at 3 areas of action. The first one is advocacy. They want, through the group, to advocate for their rights, to advocate for the rights for their rights as women and as informal workers, to fight with underpaid work, and to find the restriction on the, to fight all the legal restrictions they encounter. And they want in this group all women without restriction on nationality or on profession. This group also wants to provide collective services, like offering cooperative services for working women, like now they are doing a daycare, for example. They started to do a cooperative, and group purchasing of goods, like health insurance, for example. They are thinking that they can negotiate group purchasing of health insurance. And also this group is aimed to provide community support, facilitating event, entertainment for families, fundraising, scholarships, like to improve the social part of their lives. In this period, this group that was called Working Women, this support group, went to an NGO that is specialized in women's empowerment, that is called Women Now, and they started to enroll to enroll other women in this group. They are already 200 women enrolled in this group, and they also recruited people to come into the board. So now we have already 12 women in the board of Working Women, and they are establishing a cooperative daycare. Now they are in the phase of preparing everything, and it will be opened soon, hopefully. And they are anticipating the expansion of this working group to a satellite support group in Arsal. So what we want to retain from this experience in brief, first of all, we want to retain that the participants recognized gender discrimination in their lives. This is shown from their narratives, and this is shown from whatever they said and did in the PER. However, their pressing concern evolved around the discrimination and isolation faced by the entire refugee community and the exploitation at work. They considered that their rights as women can be fulfilled within a more just society. And participants choose to engage in transformative journey, to take in their hands their fate, and to combat multiple vulnerabilities they face and enhance their lives. They choose to address their work and life conditions themselves and advocate for social justice through community action they are leading. The stake is in the process of empowering those women, workers, to become social activists, to make a difference in their society through operating fully their support group. And we did a film about this experience, and you are all invited to come and see this film. It will be next Monday. Where it will be, Samira? Okay. So this is a trailer of the film.
هربنا هيك بثيابنا فاخذنا شيء فراحت اوراقنا راحت شيء ما قدرنا نطلع نظاميين لهون.
زوجي كان ضد انه انا اشتغل انه خلص انه انت من ايام سوريا انه انت ما في داعي تشتغلي حتى لو درستي فتحتي شيء خاص لإلك اما انت تشتغلي لا هاي الفكره كان ضدها.
الحياة صعبة ولازم المرأة تكون قوية حتى تقدر تعيش حتى تقدر تواجه الحياة ومنخاف من الترحيل لأنه بأي لحظة مثلا يصير شيء على الصعيد الدولي أو هيك يحملونا ويلا على سوريا.
اللي من 2002 موظفة انا تمريض ممرضة من 2002 يعني تقريبا صار شي 21 سنة اشتغل ممرضة.
انا ما فيني اكيد الغي هذه التغييرات اللي كلها عم تصير من حياتنا تمني جامد يعني هذا في شيء لقدام كثير بنفع ان شاء الله يا رب.
دائما طفل الحب عامرة.
Okay, now we will have a talk by three of our friends and partners. And I leave you with Malak.
In southern Iraq, this is the only school for students with impaired eyesight.
Maybe
Despite his blindness, Ismat Abdul Hafiz has obtained a bachelor's degree.
هذا اليوتيوب الفتح دي
Returned to the elementary school he attended 20.
نزلي هي كلها. So our friends will speak in Arabic, and I guess there is no problem here. But we will do the translation later for some of the audience from the consortium. So no worries. احكوا عربي مثل ما بدكم خليكم مرتاحين. Okay? شكرا.
يعطيكم العافية. يعطيكم العافية. أنا اسمي ملك الشيخ القصير، دارسة مختبر أسنان بسوريا. جيت هون موظفة بمنظمة دولية بس بشكل متطوعة يعني. نحن وقت اجينا لهون كانت الأوضاع كتير صعبة عم نعانيها بحكم اللجوء تغير من بلد لبلد. أزواجنا كانوا معنا عم يشتغلوا، في عندك أطفال في عندهم متطلبات، بدك سكن، بدك أجار بيت، بدهم مدارس، بدهم يعني كل شيء مستلزمات حياة، ونحن أكيد بدنا نسعى لحياة كريمة إلهم. فاضطرينا أنه ننخرط بسوق العمل، نضطر أنه يعني نحمل عبء زيادة علينا. فصرنا نشتغل جوا البيت وبرا البيت. هذا الشيء شكل ضغط نفسي كبير علينا بحكم أنه صرنا يعني عم نحمل فوق طاقتنا. بالإضافة أنه نحن هون بلبنان كنا بشكل غير قانوني لأنه نحن ما معنا إقامات، ما حسنا نستحصل على أوراق رسمية لشغلنا بحكم أنه القانون هون ما فينا نشتغل. فكتير أمور كانت صعبة معنا. فبهي الفترات تواصلت معنا الجامعة الأمريكية الدكتورة رهام ومايا كرمال أنه ياخدوا فكرة عن الوضع اللي نحن عم نعاني منه. فمن هون بلشت فكرة إنشاء مجموعة دعم لتحاول تحل شوي من المشاكل اللي عم تعاني منها المرأة العاملة وخصوصي الأم فهون بلشنا إنه شوي نشتغل على مشروع الدعم، نحط الأساسيات اللي عنا، المشاكل أكتر شيء وشو فينا نقدر نحل منهم شوي شوي، مثل حضانة لأطفالنا، مثل نبلش نعمل مثلا توصيل، تعاونيات، كتير قصص. هلا نحن إن شاء الله يعني بطور هاي القصص كلها وهي النشاطات، وعم نحاول أكيد نحل شيء منشاننا ومنشان غيرنا، وكل مرة عاملة عندها هاي الهدف إنها تحسن من حياتها. وهلا حتحكي رفيقتي مروة عن البقية. هلا.
يعطيكم العافية. أنا اسمي مروة دعيبس، معي بكالوريوس تمريض من سوريا. هون درست أشعة معهد TS. أنا حاليا ما بشتغل، بس عم دور على شغل يعني، وكنت أملي إنه لاقي. انخرطت بمجموعة الدعم. أول شيء تواصلت معنا الجامعة الأمريكية، وبعدين توصلنا إنه نحن لازم نعمل مجموعة دعم. هي اللي هو هيك اللي رح يكون الطريق تبعنا يعني. بعد هيك تعرفنا على النساء اللي وضعهم مثل وضعنا، وحاليا عم نحاول إنه نحن نخلق فرق بحياتنا وبحياتهم، لأنه نحن وضعنا مثل وضعهم. يعني النساء اللي عم ينخرطوا معنا بهيدا المجال وضعهم تقريبا نفس وضعنا، إنه نساء عاملات، مقومات الحياة عندهم ضعيفة، طموحات أهم شيء. ونحن بنتأمل إنه يكون شغلنا هاد فائدة لهم ولنا بالمستقبل إن شاء الله. وهلا رفيقتي إسراء بتكفي.
يسعد أوقاتكم. اسمي إسراء بكر، بشتغل فولنتير مع يسعد أوقاتكم. اسمي إسراء بكر، بشتغل فولنتير مع إحدى المنظمات الدولية بمشروع الصحة العامة والنفسية، هو عبارة عن جلسات توعية ضمن مخيمات اللاجئين السوريين في عرسال. كنت أنا وزميلتي مع مجموعة نساء عاملات. زميلتي نزلت على سوريا وبقيت لحالي، من رغم كل الصعوبات والتحديات اللي واجهتها والتعب المشوار الطريق من عرسال لمجدة لعنجر ساعة ونص، بس ما قدرت أتخلى وأتنازل عن هاي المجموعة. وفي ظروف كتير صعبة بعرسال بالنسبة لعمالة الأطفال، بالنسبة لعدد الأطفال المتسربين عدد كبير، ارتفاع نسبة البطالة، أيضا كمان في منطقة عرسال هي منطقة مهمشة. أيضا كمان في اللاجئين السوريين فيها عدد كبير، عفوا عدد اللاجئين السوريين بلبنان هي أكثر شيء موجود في عرسال، فهو عبارة عن 70 ألف لاجئ في عرسال يعيشون في خيام لا تصلح للسكن، لا يوجد فيها أدنى مقومات الحياة. فأنا رح أضل مستمرة إن شاء الله مع هاي المجموعة، وما رح أتخلى أبدا عنها. وين ما كنت، وين ما رحت، وين ما جيت، رح أضل شجع النساء على نكون تسند بعضها البعض، تدعم بعضها البعض وتوصل صوتها. أنا هلا حاليا بعرسال تم استقطاب 8 سيدات، عم أحضر تدريبات بمجد العنجر، وعم يتم تنفيذها بعرسال، انقل تدريبات لعرسال. ومجتمع عرسال، المجتمع اللي بعرسال هن أكثر ناس بحاجة لهي المبادرة المجتمعية. شكرا كثير لكم.
Go back to the table. Uh,
عن الريتنج. إيه.
So I just want with this one show about the issue of
Uh, Thank you both, and to the field workers that we've learned a lot from, or the health workers, sorry. I don't know whether to speak in English or in Arabic because we want them to hear. Hey, okay. But if there are any of the funders here, I'd like to speak in English too. No? Okay. اوكي الحقيقة يعني عرضكم كتير حلو بالطريقة اللي صار فيه تلخيص كمان خلينا نفهم كتير من الاشياء اللي عم تواجهوها. انا حسيت انه انتوا حطيتوا مشاكل مهمة كتير فوق، نحن مسميهم الروت كوزز، يعني الاسباب الاصيلة. مثل ما هلا بيقولوا لنا بغزة انه هو اللي صار انه هن هجموا على اسرائيل مشان هيك صار الحرب، ونسيوا كل الاسباب الاصيله اللي خلت المقاتلين يعني يثوروا ويحاربوا. فيمكن الواحد بيقول انه نحن هودي الاسباب الاصيله ما فينا نواجههم مثل ما انتم حسيتوا. بس انا هيدا سؤالي لفؤاد ولرهام، هيدي سوري جوانا سوري ايه انه نحن كمان من مسؤولياتنا انه ما نقول انه الحل بس بالريزيلينس. نحن لازم يمكن اقل شيء فينا نعمله وعي. يمكن يكون في مجتمعات تانية عاملين تجربات مثل هاي وداخلين شوي انه شو فينا نعمل لحتى نحسن الويجز، او شو فينا نعمل لحتى نشوف البوليسي او نشوف البوليتيكال سيستم. يمكن يكون في بالعالم هيك تجارب، ممكن واحد يجيبها بيعمل نقاش معهم، يعني مش ضروري هن رح يطبقوها، بس بالقليلة واحد يحس انه لا، هو انسان فاعل بالمجتمع لازم يغير بطرق اساسية اكتر. فهيدا كان يعني كانت ملاحظتي انه ما فينا نتجنب الروت كوزز، الاسباب الروتس الجذرية ما فينا نتجنب. وعنا يعني دور كباحثين انه نفكر كيف فينا نعمل هالشيء. وعادة الفندرز ما بيشجعوا هالشيء، اللي بيمولوا ما بيشجعوا هالشيء. انه ساعدوا حالكم هيك. هيدا يعني تجربتي انا. فبس يعني بس هيدي ملاحظة.
Well, thank you, Huda. You know, I strongly agree about the issue of the concept of resilience. There's a lot of, discussion, how to take this concept from just adapting with the situation into something that even in the concept of resilience, which is transformation, to change. And I do agree the root causes, what we call it now political economy, actually, of the problem. And I hope, this is, these findings are part of, the current studies, but I hope we can use it. That's why I went back to this slide to show that's, what we do as a sort of priority for people in the community, because they will adapt, are not the main root causes that's up. And hopefully we can use this to argue and a sort of hopefully to apply more for the issue of political economy issue.
If I can. I want also to add something. Here it is just يعني the final result. But when they did their problem tree analysis, they put into the problem tree analysis, they put a lot of structural causes and a lot of root causes. And the causes covered a lot of topics, and social, they talked about gender, they talked about gender discrimination, they talked about discrimination against women, they talked about religion, they talked about unfairness, the refugee status, etc. And this is why when they came to say support group, the support group has 3 directions. And one of them is to make their voices heard, and it is to advocate for their rights as women and as health workers and as refugees and illegal workers.
Hi.
Sorry.
Awashi, thank you for the presentation. I like the video تبع البروجكت عن جد كمان it really tells you a story كتير حلو. بهنيكم كمان. أنا كمان كنت صار لي الفرصة إنه أطلع على لونشينج تبع البروجكت وتاني مرة لما صار في أكتر. بس سؤالي يمكن أنا I missed it. So البروجكت ما بيطلع كمان على الهوست كوميونيتي. وليش عم بسأل هالشي؟ لأنه إذا في كمان في هيدا المشكلة مع الهوست كوميونيتي انه في حاسين انه ما في تقبل من الهوست كوميونيتي. يمكن هلا هيدا يكون هالمشروع بضمن مجد العنجر او بعرسال، يعني اوريدي انخرقت قصة الهوست كوميونيتي، لانه مثل ما شفت انا معمول بالبلدية بعرف انه البلدية شيء ثاني، بس انه ما بعتقد هيدا هو independent of البلديه. انا مش عم بفهم قصه الهوست كوميونتي اللي هي مش متقبله، بس بنفس الوقت البلديه هي متعاونه وفايتين هذا. هو هالمشروع بس التارجت هو ريفوجيز ولا هو ابعد من هيك؟
Yeah, thank you. So no, it's like a host communities and refugees. Actually, it's about the issue of, as you've seen in the learning side, the health committee are, all population that live in Majd al-Anjar, or representative of all population in Majd al-Anjar. So people from the Baladiyya, from organization, from refugees, so from different actually representations there. So the project is targeting, the population, vulnerable population. This one the study is only specific on the community, or what we call the close to community providers, because the issue of informal health workers is a major issue. We will present the, hopefully in April, about the one that you attended in Majd al-Anjar, about the learning site. Learning site is something, if I may say it here, to try to address the root causes, to try to understand beyond the issue of only the discrimination, the gender discrimination, or the issue of, the double burden. We try to see beyond that, and that could help, because now the learning side, they did put their strategic plan, they did, start, seeking their, own solution there to their problem. So it's a broader one, whereas this one is just like a small, not small, it's something specific on the gender. Yes, of course. I agree. But maybe Dr. Nabil actually he...
لا شكرا، دراسة كثير حلوة. مثل ما عم بتقول مونيكا أنا كان بدي أقولها. أنت عم بتقارن السيدات اللاجئات، يا ريت عملت نفس الميثودولوجي قارنتها مع السيدات اللي من البلد، يعني من عرسال، وكمان من الذكور يمكن عندهم نفس المشاكل. يعني وبعدين كمان نهاية شو التوصيات من وراء هالدراسة؟ كمان مش بدك عملت دراسة وفي عندك أمور كثير حلوة، يا ريت فيك تحط صيغة بمواضيع تقدر هالجروب يقدر يحسن من نوعية الحياة تبع المجموعة.
شكرا دكتور نبيل. ريما. I guess for the people online.
If we can go back, please, to Joanna, to the, yes, this one. I know that Monique and Dr. Nabil talked about the comparison with the local communities, the Lebanese local communities. I am calling for something different here. What is so specific about refugees? That their precarious living conditions, their precarious working conditions that we could highlight. Because if you want to have some recommendations, you want to be specific to this community, in specific, rather than comparing it to anybody else. What are the experiences of the refugees? We know that they are living, most of them are living in camps, especially in Arsal. We know that they earn lower wages. This one, low wages, it could be lower wages than the indigenous or than the local communities, the Lebanese communities. We know that there is discrimination against them, for instance. We know that there are more expectations and they can be deported at any time. So there are some specific context that they are enduring, that they are facing, that may be not that much common with the local communities. So I think that those issues need to be emphasized, highlighted, because their experiences would be, I know that the local communities have their challenges, and there are gender discrimination, there is the double burden amongst the local communities, but the experiences of refugees is distinct somehow, because it's more precarious and it's more endurance is felt that way, in addition to the discrimination and the hostility. Thank you.
Thank you, Rima. One of the issues that mentioned by our partners here is the issue of documentation. And this is a major issue for Syrian refugees in Lebanon. This lack of documentation, they don't have the right to work, they don't have residence permit, they don't have, the issue of access to education in the way that, So this is a major issue that could also lead to, because they don't have a legal document, so they are paid less. They are exploited. And so there is some, again, back to the issue of root causes, or causes of the causes sometimes. Yes, there are major issues about low wages or sort of the hostility, but beyond this issue, there's another layer, which is about, the issue of legality. They're here without sort of legal situation. And that's, for me, they are mentioned clearly, now in their presentation. And that, for me, is a major issue that rightly you said that this is very specific, comparing with, of course, the local communities that we can see, very similar causes for their. Thank you. And thank you, Dr. Nabil. I mean, this could be also responding to your concern about, comparing. This is something very important. And that's the learning side, actually, goal that we do in Majd al-Anjar. And hopefully we do it now in another municipality, because it's more on the communities in the setting. But for some specific issues like the CTC, as Rima mentioned, we need to focus on these specific causes or problems of those populations.
Thank you very much for comments, and I think that all those comments will go into the conceptualization of the future writings and papers. And you are right. Those who say that the refugee community has specificities are right, and those who say that it is the case of Lebanese too, of host community, also are right. What is the difference between refugee and the entire community? Is that refugee, first, they are deprived from social support, so they have more hardship to go through the same things. So Lebanese are not exploited at work. They are exploited at work, of course. We have nurses who are not registered nurses, who are BT, or I forgot how they say, BT nurses. Okay, they are also underpaid. We have Palestinian nurses that work in hospitals that are paid $200 per month. till now, okay? So we have the same problem. But the fact that refugees are alone, isolated, only together, okay? Their only way of doing things going is to gather together and to take their fate into their hands. And they say, okay, we will have our voice and we will fight for our rights. And they said, we are welcoming and Lebanese and Palestinian and every woman who is in the same situation as we are, who is struggling with life and with family life, and who is not getting through all this. We are here for them all. So it is just the impulse. The impulse of it was because they were refugees, because they were suffering several vulnerabilities. But of course, you are right that these problems are all over the place. It is the structure of the country.
Thank you for this presentation and for this very interesting study. I have one very small question related to the state of the ladies when they were back in Syria. Was it comparable to their state now, or is it different?
تحكي بالميكروفون عم يسأل كيف كان الوضع عندكم بسوريا وكندا.
أنا اسمي زكية دايخ، ممرضة من 2002، متعينة بمشافي. لا كان الوضع بالنسبة للرواتب مو كتير يعني، بس بالنسبة للوضع القانوني يعني كان إنه نحن ممرضات بالدولة وضعنا قانوني 100%. يعني هاي أقل شغلة بالفرق بين سوريا وبين لبنان. أكيد أنا درست دبلوم تمريض، متعينة على شهادتي وتعينت بمشفى حكومي، ضليت 12 سنة. كان في أول شيء تأمين صحي، كان في حال تقاعد إنه راح يصير لي راتب تقاعدي. نحن هون عم نشتغل بشكل غير قانوني. يعني هاي أقل شغلة، أقل فرق بين سوريا وبين لبنان. يعني عندك عن باقي الشغلات. شكرا. حدا بده يحكي؟
ما تاخذ هذا.
اوكي، انا اول شيء بدي اكرر مثل الكل انه هذه دراسه رائعه وفعلا واحد بيتعلم منها كثير، وان شاء الله التوثيق دوكيومنتيشن يعني ساينتفك يعني بمجلات علميه، بس كمان مثل هيدا الاعداد. عندي ملاحظه بس للبرزنتيشن انه انا بفضل لما ينحكى عن اي موضوع ينعطى كونتكست. مثلا ما في صوره لمسجد العنجر والمخيمات والعلاقه هاي، بس حتى واحد يعرف عن مين عم نحكي. انا بعرف بنعمم نحن المناطق وبنعمم وضع اللاجئين، ولكن قد يختلف من منطقه للتانيه، مثل ما ذكر عرسال مقابل مسجد العنجر. ف كتير أحسن واحد يكون نحط بجو المنطقة هي، وإذا هيدي هيلث شو في مستشفيات، شو في هيلث سنترز، شو في هالشيء، حتى واحد يفهم أكتر الكونتكست تبع المنطقة. أنا سؤالي بدي أسأل عن الجروب، السبورت جروب اسمه نساء عاملات، في 200 واحد. بحب أسمع بتوقع تكونوا أنتم موجودين بهذا الجروب، إنه منين هودي 200 هل توسع خارج العاملات الصحيات اللي بمجال الصحة؟ مثلا نحن دكتورة ريما وأنا عم نشتغل على العاملين الزراعيين، عاملين وعمليات زراعيين، عمليات زراعية كمان بين العاملين وعاملات زراعيين، وكمان يعني ضمن السوريين الموجودين بالبقاع. فهذا الجروب اللي موجود هل عم بيتوسع ليشمل مهن مختلفة؟ وهل بتعتقدوا انه المشاكل اللي مثلا ذكرت هون وطريقة تبويبها هل هي متشابهة بين النساء العاملات بمختلف المهن تبعيتهم أو تعتقدوا أنه بيختلفوا بين بعض؟ يعني
في حدا يشتغل بقطاع الصحة يعني من هذه
لا أنا حضانة أطفال، رياض أطفال سنة أولى بس أصدقائي في وحدة صيدلانية، في وحدة ممرضة، في وحدة مختبر أسنان. المجموعة اللي كانت معنا في حدا كانت طالبة رندا، في حدا بتشتغل معلمة مدرسة، فبكل المجالات مش بس إنه والله كل المجالات. صح صح، هي كمان فيكي تحكي معنا.
يعطيك العافية. هلا نحن أول ما بلشت فكرة المشروع 8 نساء أو 9 نساء كلياتنا كانت معنا شهادات علمية. هلا ما نحن نساء عاملات بس ما مو صحيات. هلا مثل إسراء هي معلمة صف يعني، كانت إيمان عنا هي صيدلانية. فلا ما مو شرط صحي، بالعكس نحن هلا نحن كان فكرة مجموعة الدعم المرأة العاملة بأي قطاع صحي مو صحي، أي قطاع بشكل عام شو ما كان، حتى المرأة اللي ببيتها هي عاملة، إذا فينا نساعدها كمثلا تخفف ضغط عن أولادها أو شيء كمان هي تعتبر معنا، فيها تفوت معنا بالجروب. هلا لا كيف نحن صرنا 200 وشوي؟ عن طريق الاستقطاب. نحن عملنا عن طريق المركز اللي نحن عم نتعاون معه، مركز نساء الان، عمل مع الدكتوره روهام وجوانا، عملنا انه مثل يعني رابط. هذا الرابط حطينا فيه بنود معينه، انه انت مثلا اذا عندك هي المشاكل عم تعاني منها، اذا انت هلا نحن لانه تركيزنا على المراه على الام اكثر كمان لسه من غيرها، بس حتى البنات اللي ما لهم متزوجين اذا هن عندهم هدول الضغوطات كمان تدخلوا معنا بالجروب. يعني نحن كان هدفنا الأساسي هو التركيز على المرأة بكافة المجتمعات. هلا اول شيء نحن الرابط بعثناه على كل الجروبات، اي شيء على السوشيال ميديا نزل الرابط، اي حدا نتقدم له اي اول فتره انه نحن انه انت مثلا عندك هذا مثلا الايمان انه نحن كنساء فينا ندعم بعض، تفضلي معنا. انت عندك هدف انه نحن بدك تحسني من حالك كمراه لاجئه اول شيء، تفضلي معنا. فهذا هو كان اساسي فقط لا غير، يعني نحن ما اشترطنا ولا شيء ولا اي شيء. ايه هي انا عم بحكي على اساس بس لما فتحنا
اخترنا مجموعة أساسية 15 عددنا 15 تقريبا. هدول اجتمعت فيهم مدربتنا، وعلى أساس إنه في شروط طبق الشروط، وهلا عم نعمل تدريب. نحن أساسيين 12 وحدة، وبعدين راح ننضم كلنا نعمل للمجموعة. بس عم تدربنا هلا، عم تعطينا تدريبات على القيادة. مبدئيا هلا مبلشين بالقيادة، صار عاملين 5 جلسات عن القيادة والجندر. تمكين المرأة. وفي اسا بنود ثاني يعني راح تمشي بالتدريب، بس هلا مبدئيا القيادة.
يعطيكم ألف عافية. أول شيء بحب أثني على جهود الصبايا بمجل عنجر وبعرسال، جهودهم جبارة اللي عم يقوموا فيها. طبعا هن على أرض الواقع عم يكونوا على تماس مباشر مع اللاجئات السوريات، مع بالإضافة للمنظمات اللبنانية اللي عم تشتغل هناك على الأرض. وبيشرفني أن يكون منضم جديد للصبايا. هلا نحن حأحكي عن تجربة إسراء بعرسال وتجربتنا. أنا من خلال عملي متطوعة بالICRC وبالIRC نفذنا كثير من العديد من المشاريع مع الجمعيات. من خلالها هي كانت مشاريع الدعم النفسي للنساء، مشاريع سبل العيش، تمويل النساء طبعا من خلال تكثيف مهاراتهم، تدريبهم على أشياء ممكن تكون هي قادرة على تأمن حياة كريمة. بس تعقيبي عن موضوع الزراعة اللي حضرتك تفضلت عنه، موضوع الزراعة بشكل خاص بعرسال شرط أنه لازم يكون في ميكس سوري لبناني. طبعا لأنه نحن كلاجئات سوريات أو لاجئين ما بحق لنا أنه نحن نتملك أراضي بعرسال ونكون عم ننفذ فيها مشاريع، أو من خلال إنه نكون عم نعمل عقود مع البلدية يكون المشروع عم يتنفذ على الأرض. هلا من خلال شغلي بالاي ار سي نحن قدمنا كثير مشاريع لاشخاص سوريين لبنانيين، هي مشاريع زراعيه، كنا نحن عم نامن لهم الحبوب والمبيدات الحشريه بالاضافه للبذور، بالاضافه لتدريب مهني، نامن لهم بيوت بلاستيكيه للزراعه. طبعا العمل بيكون صاحب الارض لبناني والعمال هن سوريين، فنحن بهيك طريقه عم نكون عم نامن حياه كريمه طبعا للمجتمع المضيف اللبناني وللاجئ السوري، ومنه بنخفف من حده المشاكل اللي عم تصير، كونه انه انت كلاجئ سوري لك فرصه بالشغل، انا كلبناني ما لي فرصه. طبعا هي بنكون عم نوحد وجهات النظر. اشتغلنا كثير مشاريع بعرسال، والحمد لله انه كثير وصلنا لنتائج. خلال يعني عام 2024 تنفذ مشاريع البان واجبان كمان لسوريات لبنانيات، اكثر من 320 مشروع تنفذوا على الارض. مشاريع المواشي، مشاريع انه نحن نكون عم نقدم لهم في شيء نوع غذاء خاص، هو ما بده ظروف صحية كتير، انه نحن بنعطيهم مادة بيزرعوها هن، بيكونوا من خلال هي المادة، هو الازولا، ما بعرف اذا بتعرفوا، هي غذاء للحيوانات. طبعا بيكون نحن مثل عم نشكل دائرة مغلقة، المرأة اللي عم تشتغل بالأجبان والألبان عم تكون عم تستفيد من مشروع المواشي والحليب، والشخص اللي عم يستفيد من المواشي عم يكون عم ياخذ السماد والهي من المشاريع الأزولا. فهيك نحن الحمد لله كتير حاولنا نحسن من الواقع المعيشي اللي عم يعيشه المجتمع بعرسال بشكل خاص. طبعا عرسال كتير بيئة مهمشة، ما بخفيكم أنا، كتير بيئة انه ما في مظلومه من الجمعيات، ما في وصول إلى من خلال المنظمات والجمعيات طبعا للمشاكل الامنيه اللي كانت. حاليا الوضع بعرسال اكثر انفتاح مع المنظمات، وان شاء الله بنتامل انه نكون نرفع مستوانا اكثر واكثر. يعطيك الف عافيه.
يعني الوقت خلص، بس مثل ما بدكم
حقكم علينا، بس
I think we'll take
شو بدك تزرعوا فيه؟
تأمين بيوت النايلون أو مشروع المواشي للمالك اللبناني، لأنه فيك مثلا إنه معاملة العامل السوري رح تكون بطريقة أو بطريقة، عدم التحميل، السالاريز، في هيك شيء عم بيصير